Guyana's health sector has been progressively expanding in the last 3 years, benefiting Guyanese in all parts of the country. The health sector received $73.2 billion in 2022 and a mammoth $84.9 billion in 2023. This signals the paramountcy that government placed on developing the health sector. The Mental Health Protection and Promotion Bill, the Suicide Prevention Bill, and the Human Organ and Tissue Transplant Bill were passed in the National Assembly in 2022. But apart from the physical infrastructure, modernizing the legal framework and the training also takes precedence.
There are many other opportunities that are available in the health sector. So under the Director of Training, we have about 20 different training programs that we offer to people in the health sector.
The importance of healthcare workers was underscored when President Dr. Mohamed Irfan Ali announced the sweeping increases to their salaries, in some categories as much as 74% increase. 5,000 persons are benefiting from the injection of $1.5 billion for the salary increases. Also, the Ministry of Health inked an agreement that will see the Inter-American Institute for Cooperation on Agriculture, ICA, conducting capacity building sessions with technicians in food safety. This comes as Guyana takes steps to advance the One Health initiative. Minister of Health Dr. Frank Anthony also reiterated that Hinterland health facilities will be equipped to meet the health needs of the people there. This year, $1 billion was earmarked to aid this process. In addition, the Karasabai, Anai, and Sand Creek health centers will be upgraded into district hospitals, providing radiology and laboratory services. Telemedicine centers have also been constructed in regions 1, 7, 8, and 9, providing real-time remote diagnosis and treatment in remote Amerindian communities by using technology. Guyana was also commended by the U.S. Center for Disease Control and Prevention for the work done in HIV and AIDS.
We commend the Ministry of Health, the National AIDS Program Secretariats, and most especially the healthcare workers who are working here in these facilities for the work that they do every single day to provide quality services for persons living with HIV.
The local health sector received a huge boost as a stem cell therapy and immunotherapy services commenced earlier in 2023.
When a public healthcare system is operating efficiently and reliably, it allows enough information to change the health information set and the healthcare set before a health crisis occurs. What that means is that stem cell is highly effective where there's early diagnostics. This is important. So the public healthcare system must be able to support diagnostics at a very early stage.
Residents of the Deep South Rupununi region are now able to undergo surgeries right at Aishalton as government established the hospital's operating theater. A plethora of successful surgeries have been completed.
Under surgery for my gallstone, and I'm very happy that I had right here in my own village, so that I didn't have to travel to Lethem or to Georgetown. I am very thankful of that. So I'm right here, I could go nearby to my house.
The theater was opened during a 4-day medical outreach led by Director General of the Ministry of Health, Dr. Vishwa Mahadio. Shulinab, Shia, Awaranao, and other areas also benefited from services like obstetrics, gynecology, internal medicine, ophthalmology, audiology, speech therapy, dental services during the outreach. This is also part of the President's mandate to take medical services to people in all parts of the country. Guyana's capacity to protect its citizens from COVID-19 has been enhanced after receiving 5,040 Paxlovid pills from UNICEF.
How these medications work, it's really an antiviral medication, and as you know, SARS-CoV-2 is a virus. And so at critical points in the life cycle of the virus, it would interrupt that life cycle, and by doing so, prevent the virus from replicating. And it has been quite effective in doing so. So most people who use this medication actually saw a reduction in the time that they spent, and even if they were very symptomatic, you would see that change quite rapidly.
Close to 100 hemodialysis patients have received $600,000 each from the Health Ministry to offset their treatment costs. This money is part of the $863 million allocated by government for these patients.
Well, it's been a great help. 7 years on dialysis, the financial aspect of it is very demanding, and as my colleague said earlier, a lot of people think the dialysis is just going and have the treatment, but it's a lot of other things that related to it, a lot of complications health-wise, people with eyes, bones, and all these things cost extra financial assistance. Apart from that, your diet you have to maintain, transportation. So it's a great help.
Well, the government assistance is a great thing for me. It certainly goes a far way in helping me with my dialysis-related expenses. Some people believe that dialysis expenses is just paying for the dialysis, but then you have to get to and from dialysis. You have nutrition and so on, something that we can hardly afford. So this assistance goes a very far way in assisting us with those.
The ministry has started to formulate a 5-year plan for mental health in Guyana. New psychiatric services are being made available at the Georgetown Public Hospital Corporation as a $98.9 million facility was officially opened. Services include adult and child psychology, geriatric psychology and support services, electroconvulsive therapy, ketamine services for depression, neuropsychiatry, and forensic psychology are also expected to come on stream. Persons from around the country will be trained to operate and maintain medical equipment in hospitals and health centers as government launched the biomedical program. Minister of Health Dr. Frank Anthony encouraged the nurses and midwives to take advantage of all the opportunities that are being offered by government as he launched the inaugural continuing nursing education. The program aims to further develop the knowledge and the skills of nurses and midwives.
We also want to train people in subspecialty areas or specialized nurses. And we are opening up new opportunities for these types of specialization. We want people to be there at the immediate place to make sure that things can be fixed quickly, so our turnaround time, downtime, can be drastically reduced from months and years to basically to reduce that to hours.
More than 30,000 residents in Region 5 will benefit from improved healthcare services with the completion of the $6.6 billion modern hospital at Bath Settlement, West Coast, Berbice. This is just one of 6 regional hospitals that government has committed to providing for Guyanese.
One that is comprehensive, one that looks at the challenges of the future and position Guyana to be part of the solution of those challenges. That is why we are speaking about creating the legislative framework allowing for modern medicine to evolve, whether it is stem cell, research and development. We are creating the entire architecture for the evolution of medicine in Guyana.